I am a consultant hematologist. I specialize in the diagnosis and treatment of blood and bone marrow disorders. The aim of this short film is to provide some basic information about myeloma for the newly diagnosed patients. In this short film, I'll talk about what myeloma is, the symptoms and signs associated with myeloma, tests and investigations required for the diagnosis and staging of myeloma, the treatment options available for myeloma, and briefly about living with myeloma in general. I hope that following the discussion of these crucial points, you will be empowered with a better understanding of myeloma. This, together with a strong relationship between you and your hematology team, will make things clearer to you and your loved ones. Myeloma is a cancer of the bone marrow. It is a malignant disease where the bone marrow produces too many cells of a certain type called plasma cells. The plasma cells are an important component of normal bone marrow. Normal plasma cells produce antibodies which help in fighting disease. However, in myeloma, the plasma cells become cancerous and begin to multiply and crowd the bone marrow. This results in the plasma cells interfering with the normal growth of other cells in the bone marrow. This then causes anemia, low platelets, and low white cell counts. These abnormal plasma cells also secrete bits or components of the faulty antibodies, which are detected as abnormal protein, also known as paraprotein. In most myeloma patients, some of these abnormal proteins will appear in the blood or in the urine, or both. And these are used for the diagnosis and for the assessment of the disease activity during treatment and as well as during follow-up. These abnormal proteins can in some cases clog or damage the kidneys. This does not happen in every patient with myeloma, but is more frequent in advanced disease. The abnormal plasma cells also secrete chemicals which can affect the structure of your bones, leading to some bone damage. Some of this damage can be picked up on X-rays as lytic lesions. In advanced cases, the damage to the bones can also result in spontaneous bone fractures. Remember, these do not happen in every patient, but they're more likely in advanced myeloma. As the majority of the body's calcium is also found in the bones, therefore interference by the abnormal chemicals secreted by the myeloma cells can lead to high levels of calcium. This itself can cause harm or symptoms. The symptoms of myeloma are often vague and nonspecific. In some patients, there may be tiredness and fatigue due to anemia. In others, there may be increased tendency to infections. There can also be bony pain due to damage of the bones from myeloma. Some patients may have symptoms like constipation and nausea due to high levels of calcium. In others, there may be symptoms of unexplained bruising or abnormal bleeding because the extra protein from myeloma can interfere with the clotting system. Like any other cancer, myeloma can also lead to weight loss and generalized decline in health. It is important, however, to remember that many of these symptoms mentioned may also occur in other diseases and are not specific to myeloma. Therefore, specialist laboratory investigations are the mainstay of diagnosing myeloma. As mentioned earlier, myeloma is associated with an overgrowth of antibody-producing cells in the bone marrow called plasma cells. It is bits or parts of these antibodies that can be detected as an abnormal protein in the blood or urine. In most patients of myeloma, there is production of paraprotein, and there is also abnormal production of smaller components of paraprotein called light chains. The light chains can be detected in the blood, but also can appear in the urine when they are referred to as Bence-Jones proteins. In about 15% of patients, there is no paraprotein and only light chains are produced. Therefore, in patients suspected of myeloma, essential investigations will include tests for the detection of the paraprotein and light chains in the blood as well as in the urine. Also, a full blood count will be done. This is to detect any evidence of anemia or low platelets or low white cells. Blood chemistry tests will also be needed to assess the kidney function and calcium levels. As myeloma can affect the bones, it is therefore essential to perform a special set of X-rays of the bones. This is called a skeletal survey of the bones. In patients of myeloma who have evidence of disease or symptoms affecting the spine, an MRI scan of the spine is needed for more detailed assessment of the spine. In order to confirm the diagnosis of myeloma, a bone marrow biopsy is performed. The bone marrow biopsy is done under local anesthetic using a needle to take samples from the bone. The samples are taken in liquid form as well as solid form, and specialized tests are done to confirm the diagnosis of myeloma. There are a number of very good treatments available for myeloma, and many others are being developed. These are very effective in eliminating myeloma cells, leading to near complete clearance of the disease from the body. However, none of these treatments can completely cure myeloma, and myeloma tends to come back slowly over time. In some patients, myeloma may not return for quite a number of years. And when myeloma does return, there are a number of effective medications available which can be used in various combinations to successfully treat the relapse of the disease. Such further treatments with second and third line of medications can significantly improve survival in myeloma patients. And as I said earlier, there are many new medications in development which are likely to improve the outlook even further. Another important fact is that research has shown that there is no particular advantage in rushing to the chemotherapy in patients of myeloma where the myeloma is not yet causing any harm. In other words, where the patients are symptom-free. The symptoms or harm from myeloma is defined by the presence of anemia or kidney impairment or high calcium or bone lesions on X-rays. In patients whose myeloma is not causing such damage or ill health, treatment therefore is not required. Such patients, however, are kept under close observation, and specialist blood tests are done at least once every 3 months to monitor the disease closely. As soon as any signs of myeloma becoming symptomatic or causing harm are detected, treatment is considered. When the patient is ready for treatment, the treatment options are chosen based on the patient's condition, age, fitness, and the presence or absence of any other chronic ill health. There are good treatments available to suit myeloma patients of all ages. For patients who are fit and well under the age of 70 years, further treatment with high-dose chemotherapy in combination with stem cell autotransplant may be considered as a consolidation treatment. This is usually done after achieving good response to the first line of treatment. Other treatments like radiotherapy can be given for pain related to the bone damage due to myeloma. In a few cases, the damage to the bones from myeloma may lead to fractures, and surgical treatments may also be required. Keeping yourself well hydrated is very important, as this reduces the risk of kidney damage from myeloma. It would be useful to develop a habit of drinking between 1.5 and 2.5 liters of water each day. This doesn't have to be plain water, and it can be water-based fluids. Myeloma also predisposes you to increased risk of infections, and you should seek medical attention if you're feeling unwell or have symptoms or signs of infection. Also, be careful with over-the-counter medications, as some of these drugs may increase the risk of harm from myeloma. Please contact your hematology team and take advice before you use any over-the-counter medication. It is important that you continue to keep yourself informed about your disease. It is equally important that you create an ongoing partnership with your hematology team for the best management of your disease.